All right, why don't we get started? Thank you to all of you who are able to join us this afternoon. Just confirming I'm unmuted, and I am. We're really glad to have you. Welcome to This Week in Washington, our policy update on COVID-19 response and recovery. I'm Ben Kershaw, the Director of Public Policy and Government Relations at Independent Sector, and we are very happy to be joined today by Wes Coulomb, Managing Director at Washington Counsel Ernst & Young, our longtime partner in government relations and policy issues. Glad to have you here today, Wes. For those of you who are joining us for the very first time on an Independent Sector webinar, welcome. Independent Sector is a national membership organization representing a diverse set of nonprofits, foundations, and corporate giving programs working to ensure that all people in the United States thrive. As part of our webinar feature, all lines are currently muted, but we will pause periodically for questions. To ask questions, you can type them in the Q&A box, or you can email publicpolicy@independentsector.org. You will have much better luck in the Q&A box. This webinar will be recorded and it will be posted on the Independent Sector website and emailed to you within 24 hours. And when you leave today's gathering, you'll be asked to take a survey, which we hope you'll fill out to help us better tailor content to your needs. We really look forward to your questions today, and we appreciate your attendance. So before I turn things over to Wes, I also want to wish everyone a happy NFL Draft Day. Unless you're watching the Nicaraguan soccer leagues, this is as close as we get to real sports in this time of much greater concern and problems. So before I get Wes's take on whether the Patriots are going to trade up to draft a quarterback in the first round, I will just flag for folks that this gathering we're having today, this policy education event, is open to IS members and to IS non-members. Historically, a lot of IS policy education efforts have been membership benefits and membership events. We've opened this up during this unprecedented time to all who need and could benefit from this information. But if this is useful to you, boy, would we love to have you as a member of the Independent Sector community. We've seen tremendous, response and growth in membership, both from new members and welcoming back some prodigal members over the last few weeks, and we're really excited about that. So please check that out on our website if you're interested. Now I'm happy to turn things over to our NFL draft guru and our tax policy congressional expert, Wes Coulomb. So Wes, as it seems every time we talk to you, there is something happening at this moment on Capitol Hill. Major legislation of importance to the sector is poised to advance through the House of Representatives, in the next, hopefully in the next hour or so. Can you give us the latest on this legislation, what its outlook is, and some of the highlights in it?
Sure, Ben. Yeah, thanks for the intro. Hope you can hear me okay.
Yeah.
Yep. So we've gone through the CARES Act, which passed at the end of March. People are familiar with that. What happened in the interim was pretty much that the PPP program, the Paycheck Protection Program through the SBA, ran out of funds fairly quickly. And so there's a push to enhance and increase the funding for that program with the SBA. Leader McConnell tried to push that through a week or so ago, got resistance from Democrats who wanted to do more than just that. And so over the course of the last 2 weeks, they've negotiated a revised package that would both increase funds for the PPP program by $310 billion, about $650 billion in funds, as well as provide more funds for the Economic Injury Disaster Loan Program, SBA, as well as provide about $75 billion for hospitals and about $25 billion for testing, which is the main push the Democrats wanted to add to the package with more for hospitals and testing. They also wanted to push for some more funds for state and local governments, but those funds were kind of put off for a future package and not part of this CARES Act 2.0, if you will, or 3.5, however you want to call it, in this environment. So we've seen now 3 big pieces of legislation pass through Congress, 2 smaller ones than the CARES Act, and now a 4th piece is going to pass today. The House it already passed earlier this week. The Senate on a vote, and the House is debating it right now. And the vote should start about 2:30 on 2 items on the House agenda. One is for a select committee, oversight committee for the CARES Act, and then after that votes occurs, and they'll pass. They will vote on this increase in the PPP program, additional funding for hospitals and testing. It's HR 266. That should pass. We think should pass by this afternoon and become law by the end of today when the president gets the package on his desk either tonight or tomorrow.
Got it. Okay. So you mentioned an additional $310 billion for the Paycheck Protection Program. There's a set aside within that.
Yep.
You know, the nonprofit community has been pushing very hard for a set aside for nonprofit organizations because of some of the challenges that our community has faced navigating the PPP. Can you talk a little bit about the set aside that is in this bill advancing today?
Sure. So there's additional $60 billion of that additional $310 billion amount. So $250 billion would go towards the core program that's already in the law and the PPP as part of the CARES Act. And they put additional $60 billion in there to be set aside for 2 buckets. One, $30 billion for some small financial institutions, small banks, to help serve their customers in their communities, as well as $3 billion for smaller community financial institutions, CDFIs they're called, as well as small credit unions. And the thinking behind this, and this is really pushed by the Democrats in response to a lot of concerns by both nonprofits, other small businesses, other communities that are underserved by the traditional banking community, to make sure they had a set aside of funds to serve their constituents and their clients. And so this fund can only be used, these additional $60 billion can only be used by these smaller banks to serve their clients and will not be part of the larger PPP program. So it kind of opens a different avenue for folks to get funds. As I think people are aware, there was a rush on the bank, if you will, in applying for these loans. A lot of the big banks, took applications, and there was concern that some of these smaller organizations, nonprofits, et cetera, were not able to get, in front of the line and get the funds as quickly as others. And so this would kind of hopefully help address that. Now, it's not a total set aside for nonprofits like we'd asked for, but hopefully it'll be helpful at least getting some more funds to underserved communities and help get some of those funds directed towards small organizations, smaller nonprofits, as well as some of their communities that are in need of the funds.
Okay. And so you mentioned applying, how there was a run on the bank, obviously a tremendously popular program, PPP, EIDL program also really popular. Those programs are closed for applications right now. When can people start reapplying? What are we expecting on that? I know that's sort of the $1 million question. And maybe we don't have great answers to it, but what are you hearing from folks on the Hill or at SBA about, what the outlook for reopening those programs will be?
So there's 2. So the PPP program is done through a bank. And so you'd have to go to your bank. I think they're still taking applications, even though they're not able to process them with the SBA right away until the SBA opens it back up. So you can go to your bank now. With a set aside, it might actually open up new banks who weren't part of the program before to now participate and they might take them a little bit of time to get their application process together and their paperwork together. But you can go to your bank now and get the application in process. And then when the SBA opens it back up, which I hopefully will be, by tomorrow, for both the PPP program and the EIDL program is actually direct loan through SBA, not through a bank. And you can go through the SBA website for that application and get that put in. So I would advise folks to get that together and as soon as tomorrow get that application put together with both the bank or the SBA and hopefully get in the queue. Once the funds start flowing, you'll be able to get those funds more quickly. You're on mute, Ben. You're on mute.
All right. Thank you all. 2 p.m. in addition to being policy education hour at IS is what my toddler likes to call screaming hour. So you'll see mute from time to time. So we have a question about the 60 billion. And I want to be clear, the 60 billion is set aside within the 310 billion allocated to PPP. So that's 250, as Wes noted, for the core, pre-existing program, and then the 60 billion for these smaller financial institutions. So I want to answer that one, and then we have a question about whether any changes were made to eligibility, and we'll talk a little bit more about that. But the short answer is that the changes we are pushing for in eligibility were not made in this bill, and we're not contemplated in this bill to a great extent, and those are part of future conversations. So we'll talk a little bit more about that in a moment. I also want to talk a little bit about something else that's in this bill, and Wes, let me know if you have thoughts on this as well. Disaggregated data on testing and on health outcomes. So this is something that the speaker actually mentioned in the press in an interview, and something that independent sector joined with a number of organizations that were leading a push for releasing some disaggregated data about outcomes, about infection rates of COVID-19, and that data is hard to come by, but we think it is critically important so that the country and the community can assess, truly how this disease is impacting, our community as a whole and individual communities within the country. So there's some language in the bill that spells out some of that. Wes, do you have any reactions or additional context on that?
No, other than what you talked about, I think there's been interest in finding out kind of the impact across different communities of COVID-19, and so this would be helpful to kind of dissect a little more detail who was impacted and why, and so this is important information for them to find out.
Got it. Thanks. And I'll say for folks who often these massive spending bills are 1,000 pages long, and they're not even, they're not 1,000 pages that are pleasant to read. This one's like 25 pages long. So if people want to take a look at the legislative text that spells out specifically this report that the HHS secretary needs to file about disaggregated data, it's on page 17 or 18 of that legislation. So encourage folks to check that out. So I want to turn now towards our continued push for changes to the CARES Act. As Wes noted, this bill that passed today, that we expect to pass in the next couple hours, is sort of a re-upping of funding, but independent sector and our community, continue to have, great concerns about individual pieces of the CARES Act. So, we know that the development of a next bill is sort of underway. Obviously, conversations and lobbying efforts continue. Wes, what can you tell us about the status of of that package coming together, absent content for it. But, there was a House Democratic Caucus meeting this week. We have members coming back into town maybe the week after next. What's that process looking like right now?
Yeah, good question, Ben. So there's a lot of uncertainty, I think, about what's next for Congress. They've now passed 4 bills, obviously the CARES Act being the biggest one, and then today they'll finish that kind of plus up, if you will, additional funding for some of the programs in there. But they're already looking towards another bill, a 5th bill, if you will, that would go beyond what we've already done thus far. I think that part of it is to look at some of the provisions of the CARES Act, if there's ways to be improved. They can look at things like that, maybe improve different programs. So PPP, for example, I've been trying to push them to expand a little bit to larger nonprofits. We've also still haven't seen any details from the Treasury on the Main Street Lending Program for how nonprofits would apply for that. We get some more details out of that. One issue that also they tried to negotiate as part of this package that's being passed today, that's the state and local government funding increase. And that was not part of this package, so that's going to be front and center for the next package to try to get some more funding for state and local governments that the government has been pushing for. Leader McConnell has been less interested in doing that, not as open to doing that funding, but it's something that they'll have to talk about in the next phase. Chairman Neal was on the floor today during the debate on the bill today and talked about the next phase of issues. He talked about healthcare being an area he wanted to focus on, more funds for hospitals and helping them recover from this. Also, healthcare workers. He wanted to help find healthcare workers some relief. There's also a concern about healthcare costs for individuals, employers, individuals, and how they can help alleviate the burden of the increase in cost because of COVID-19. And make sure people have their healthcare benefits. They might lose their jobs or employment, right? Employment's quite high, and so people might lose their health insurance. There's COBRA subsidies that are on the table for that conversation, be able to kind of buy into your employer plan, even though you've been laid off, and help for employers to help fund their pension plans and their healthcare plans. There's also interest on the Democrat side of doing maybe another stimulus check for individuals, taxpayers, and also possibly some extension of unemployment insurance compensation as well. I know the sector has been interested in trying to tweak the reimbursement of that employment for nonprofits, given the arrangement they have is different than for-profit employers. So maybe that's an opportunity if they do some more employment insurance, get that corrected and fixed as part of that plan. There's also been some broader conversations about infrastructure spending. I think that's more a separate package down the line that could be folded into this conversation as well as they get talking about it. So lots of different ideas out there, different areas. Timing is still also unclear. There was some conversations in the House about doing some sort of remote voting or proxy voting type proposals. They put those aside for today. There's some conversation about when they can come back and actually start doing some work and doing some voting, having committee meetings and so forth. May 4th target date they set. Whether that actually happens on May 4th or earlier or later is still kind of an unknown question. But definitely the work on the next phase of legislation is ongoing right now between the House and Senate staffs and committees. And so, as in the sector, we're working hard to kind of get our issues in front of them. And so I, advise organizations to weigh in with your member of Congress if you have issues or concerns or questions. Now is the time to speak up on those.
Great. Okay. So thank you, Wes. So you mentioned, the independent sector and the nonprofit community's concerns. So I would just continue to flag and emphasize for folks that the independent sector continues to push for changes to the CARES Act. Someone's asked a question about the 500 employee limit on the payroll protection program. That's still something that is gravely concerning to us. We also touched on very briefly the need to treat self-funding nonprofits fairly for unemployment insurance, funding for key programs. One of the programs we've flagged at IS as a major priority is election assistance, as well as improving the $300 cap and the 1-year limitation on the above-the-line non-itemizer or charitable deduction. So we continue to push on those efforts. I would note for folks that maybe the most urgent, most visible vehicle for that push right now is a sign-on letter that Congressman Seth Moulton of Massachusetts and Congressman Fitzpatrick of Pennsylvania are leading to House leadership, calling on them to make many of these changes in CARES 2.0. If people get independent sectors action alerts, you would have received an email about that towards the end of the day yesterday. The deadline for members of Congress, for representatives to join that letter, has been extended until the end of the day on Tuesday. That's Tuesday of next week, the 28th. So we independent sector will be continuing to reach out to members of the House to ask them to lend their names to that letter. And we hope you all will do the same, either through, if you want to distribute that grassroots action to your networks, you are of course always welcome. Or, we know many of you have really close relationships with individual offices. So individual outreach is always the most powerful. So we hope people will take advantage of that opportunity. So Wes, you've talked a little bit already about the about potential kind of big buckets of work within another CARES bill. So thank you for that. That was something that we wanted to touch on. How do you see this Moulton Fitzpatrick letter, coming out? I think, the Moulton and Fitzpatrick offices have been, tremendous advocates for our sector. I think they'd be the first people to tell you that they're not going to be in the room when the very few people make final decisions about what is in this bill. How do you see that letter factoring into this overall process?
Well, I think it's helpful to have members weigh in with their leadership, which is kind of what this is all about. Like you said, they're kind of operate on a remote basis, and so they're not able to, have personal contacts. But, this letter will be helpful to kind of weigh in with the leadership in the House and get on record that there's a lot of members. And hopefully we get more sign members in this, Republican side at least, and also Democrats kind of weigh in on this to show there's interest in fixing these things for these items for the nonprofit sector. But I think also the key is weighing in with the leadership. Speaker Pelosi and her team, Chairman Neal, the Ways and Means and his team, because they're the ones who are going to be, as you mentioned, writing the next package, the next bill. I think that looking at the progression of these bills and where they start, the last two bills have pretty much started in the Senate. I think this next bill is going to probably start in the House, and that's going to be the first draft will come out of Speaker Pelosi's office, and with Chairman Neal, I think one of the leaders on that effort. Putting that together. So I think the House is kind of the first point of attack, if you will, in trying to get the interest of the sector on their minds and part of their package. So I think the House is definitely the place to start. I shouldn't ignore the Senate. The Senate's going to be also equally influential in weighing in on the final product. So we should make sure we have comparable efforts on the Senate side to get both Republicans, especially, and Democrats in the Senate to weigh in for our priorities. And so it's also a place we should focus on, and people should weigh in on both sides of the Capitol. But I think it will start in the House this next phase, and then the Senate will weigh in as well on this process. So I think the Moulton effort is important, but I think we need to have more focus, I think, also on leadership in the House and Senate and the committees as well.
Got it. Thank you. So before we turn away from this bill to some other updates, seen a couple questions about unemployment insurance relief for self-insured nonprofits from our friend Marie Ellis. The intention of both the Moulton Fitzpatrick bill and the bipartisan letter that they're leading does flag the need to increase that percentage from 50% to 100%. So that is certainly part of the that's certainly part of the effort. Other questions that we should tackle on this? Let me see what we got. Question from our good friend Regina Bell about the sector and the community's ask to provide data from SBA about nonprofit and for-profit success through the PPP. I think it's an excellent question. To my understanding, independent sector has not yet heard back from our request to SBA about our request for whether nonprofits, the level of support from nonprofits. If we're being honest amongst friends, this big sign-on letter is really important to raise the visibility of this issue, both directly between our community and SBA, and with the program's authors on Capitol Hill. And we've certainly been in touch with some of the program's authors about this request as well, and we know that they have it on their radar. If SBA weren't waiting on our community's every request, they have also received a detailed request for information from four high-powered Democratic senators on this issue, Chuck Schumer, Ron Wyden, Gene Shaheen, and Ben Cardin, asking them for a wide range of information that also asks about nonprofit info. So we know that even if SBA is not waiting on correspondence from us, they certainly have had this put on their radar. So that is good and something we'll continue tracking. I want to move on to another key program that we've not yet talked about today for nonprofits and businesses with more than 500 employees. And this is the Main Street Lending Facility announced through the Treasury. And I want to get Wes's thoughts on this. I would just flag that the initial term sheets released by the Federal Reserve didn't mention nonprofit organizations, and independent sector and many other nonprofit organizations filed comments last week urging this facility to include nonprofits and to recognize the unique circumstances of nonprofits, potentially with interest rates and terms that are more appropriate for our community's importance on the front lines and the challenges that we face. So that was some of the input that our community offered. Wes, what do you see as the outlook for that program and for nonprofits' role within it?
As you mentioned, the CARES Act had a separate loan facility through the Federal Reserve and Treasury for mid-size, larger organizations, 500 to 10,000 employees. The Federal Reserve came out with a new called the Main Street Lending Facility. Some details about that. It really only applied, looked like, to for-profit businesses. Did not specify how nonprofits could apply for that. That program still is not actually up and running and funding quite yet, so we haven't missed anything quite yet. But there is some conversations taking place, and they took comments last week on it about how to tailor that program for nonprofits. And it's unclear if they're going to try to do a separate facility just for nonprofits or try to modify that current to help nonprofits access those amounts. And that facility is basically a loan program, no forgiveness piece in it, like PPP. It's just a loan facility, 4-year loan between 2.5% and 4%. There are certain restrictions in there that were part of the statute that apply mostly to for-profit businesses. You can't buy back your stock, pay dividends, or some compensation restrictions. And so the question will be, is how do they do that in the nonprofit context? I think they really need to have some more guidance on this program coming out on how it would apply to nonprofits, or have a separate fund just for nonprofits alone. And so we're waiting to see what that is. And hopefully they'll come out with something in the next several days or at least a week.
Got it. Thank you. So we are a hair beyond our 2:30 end time for this afternoon. And so I don't want to go too much longer. We want to try to be respectful of everyone's time. We know that a weekly gathering is a lot to ask of all of you during these very busy times. And I'm just checking to see if we have any other pressing questions that we can answer very quickly. I know a number of these are very good and detailed questions. We've had folks ask about whether there's first responder public safety agency money in the bill that's passing today. And I think the answer that you heard from Wes was that there is not, but that state and local assistance will be a key piece of a next bill. I think we'd be.
You're unmuting again, Ben. Hey, Ben, you're on mute. Still can't hear you, Ben. All right.
I think I'm back now. I apologize.
There you go, no problem.
It was dialed in on my, anyways, people don't care about the details. We will take a look through the questions that you all have submitted. Again, I want to thank everyone for joining us this afternoon. This is an unprecedented time, tremendous national health, societal and policy challenges. And we are so grateful to have all of you with us working through these issues together. We hope that you will join us again next week, same place, same time, as we continue discussing This Week in Washington and how federal policy is impacting the charitable sector and its ability to serve communities in need. So thank you again. Please be on the lookout for a survey on this event, and we will talk to you next week. Thank you as always, and thank you all.